Hello everyone, I'm Dr. Lisa Erickson, and today I'm going to discuss the benefits of diagnostic ultrasound. I use diagnostic ultrasound in my office to evaluate injuries of the finger, hand, and elbow. This is one of the most valuable types of imaging because we can see pulley tendons, we can see within the joint, we can see muscle gliding, we can see swelling, and we can see any bony debris from accidents. So diagnostic ultrasound uses sonar to evaluate the tissues, and the reflection comes back based on how much water is in the tissue. So just like a dolphin, with fingers I immerse the hand in the water, and then choosing which, we're going to go hand wrist here, choosing whichever structure we're looking at, there's quite a bit we can see. So for example, I'm going to evaluate the pulley tendon, the A2 pulley, which is located right here on the finger. We're going to go in and look at that, and what we see, I'm going to go ahead and freeze that for you so you can have a look. Freeze. So here is one finger, here is the second finger, here is the base of the bucket. So we're looking down the finger, straight down the fingers this way, and this white here is the bone. And what we see above it, this little round circle, those are your pulley tendons, and the space above them is where your A2 pulley sits. And this little halo of black around them is the space where the pulley tendons glide through underneath where your flexor tendons glide underneath the pulley itself. So by evaluating on this view, we can also do a stress test, and we can see if that pulley is stretched out. And what a stress test looks like is, I'm going to go ahead and unfreeze. So we're going to go ahead and look at that pulley. And then we're going to go ahead and load it. So I would have someone put pressure on the tip of the finger, and we'd load it, and we would see, does this bundle of flexor tendons move away from the bony part of your finger, or do they stay anchored? If they move away and we see black appear underneath them, that is a brand new pulley injury. However, if they do not move away, but the tendon slightly changes shape, maybe goes from round to oval, and does not move that much in distance, then it is just slightly stretched out. So if you're having pulley pain and we load that sucker on the ultrasound, and this does not change at all regardless of how much weight we're putting in a crimp position, you've not torn your pulley. The issue could very well be a flexor tendon issue, or it could be a nodule on the pulley or near the pulley, or you could have another issue. So that's a diagnosis of a pulley tendon issue of the A2 pulley on a finger, and this is a musculoskeletal diagnostic ultrasound. It runs between $175 to $225 at a basic hospital, and in my office it is $175 for a new patient exam with the ultrasound. Anyway, so that's how it works, and that's the info on that. Thank you so much for tuning in.